Dr. Puneet Arora, Medical Director, Bourn Hall Fertility Centre, Gurugram. Reproductive health is a global health priority according to WHO, and infertility is one of the aspects of reproductive health. It is what we defined as couples, men and women, who are unable to achieve pregnancy even after trying for more than 2 years or 3 years. Even though India being a densely populated country, the burden is not less. The recent census did suggest that around 2 to 4% of our couples do come and seek for treatment. The burden may be larger than this, but that's the population which comes to different IVF centers to seek treatment. And when we say it being taken up largely, the reason being it's a social stigma. Not having a child becomes a social stigma for some couples. It can be emotionally, it can be psychologically taxing to men and women. And it's not, I would say, about India now, it's globally as well. According to the census done by WHO in 2010, around 49 million of couples do come at some point seeking treatment and have been unable to achieve pregnancy even after 5 years of trying. So the burden is there. And the recent trends have shown, even though it's an American study, that around 70,000 children are being born annually through assisted reproductive technology. So now coming to assisted reproductive technology, it's one of the treatment aspects which is given to infertile couples. There are various ways we help them, but one of the methods is IVF or assisted reproductive technology. So the trend is increasing. So the reason can be multifactorial why this trend is increasing. Maybe people are more aware, they are coming forward and seeking treatment, or maybe largely the problem itself is increasing. But I think we need more data and studies from India to find what is the reason of increase in India. When we talk about assisted reproductive technology, there are various methods. Some of them involve handling gametes. Gametes, what I mean is handling eggs and sperms, because that is the way an embryo or a future pregnancy is formed, and that's formed in the lab. So it's like handling, not exactly I would say an organ, but it's handling a gamete, which is not formed into a human being, but it's a precursor. So it in itself comes with a lot of legal and ethical foundations, and that's why once we start practicing, we do abide by our laws, our guidelines which we have. And at the moment what we have in India is the ICMR guidelines, which is Indian Council of Medical Research. They have put certain good practice points as to what a doctor, a center who's practicing in this field should follow. Now, having said that, this is not a law, right? So you don't have to follow it, but they become your guides. They become a guideline. If we compare to practice of ART in UK, USA, maybe they have more strict laws, which we don't have here. So that's something we really need to work on, and maybe that can be a future plan, how to streamline the practice of ART in India. So Bourn Hall, I would say I feel proud to be here. It's where the science started. So Bourn Hall, UK, Cambridge takes the credit of having the first child born through the IVF treatment 40 years back. Louise Brown, who was born through IVF, will be turning 40 this year in July, and she herself has been successful in harboring a child herself on her own. So that's where we, the Bourn Hall Gurugram, come from. This was was created in 2012, and since then it has been providing a lot of happiness to couples seeking treatment for infertility. So I would say Bourn Hall is the place where science started with regards to ART. So as such, like when I said about the challenges, one of the challenges is, just going back to challenges, is non-presence of any law, right, as to who can practice infertility, who can start an ART center. There are guidelines, but not exactly, I would say, black and white. So there are a lot of centers. Because of that, there are a lot of centers, there are a lot of doctors practicing infertility, but Bourn Hall stands from viewpoint of excellent clinical training, because all the doctors are specifically trained in ART medicine. It's like a standalone fertility center which just caters to the needs of infertile couples. Secondly, our embryology lab, what we said about handling gametes. The gametes have to be handled in a lab which can mimic the human body. So the environment of the lab has to be really very important. And Bourn Hall, like I said, Bourn Hall UK were the pioneers. So we have the technology from there in Gurugram in India, which looks after all those aspects of having a clean lab. And that's why Bourn Hall India gets the credit of having the only Asia's clean room lab. It's just, when I say about clean room, it's the circulation, the temperature, the volatile particles which have to be kept under strict control when we are handling gametes. And Bourn Hall is known to offer that. So on an average, I would say we see the patients, number of patients coming in seeking infertile treatment is around 3,000 to 5,000 per year, and sometimes more. Out of them, how many of them specifically go for, because like I said, there are multiple ways by which we help them. One of them is ART. If we talk about specific figures, it's around 40% of them do need IVF at some point in their progression of symptoms. So I would say the number of cycles which are done per year is anything ranging between 600, 800, 1,000 to 1,200, depending on the months and season, because a lot of patients also have that myth that maybe certain months are more fertile than the rest of the months. Like I said, the Bourn Hall is where the science started. So the plans are very much, the aim is to expand the clinical, the embryological, the ethical practice across India, so that it's not just restricted to one place, but it is pan-India. And that's where I would say that we would very much stand there to provide a very ethical practice to our infertile couples, and we do plan to expand in near future offering these services.